watching Wish TV, News 8 at 11 with Phil Sanchez.
Welcome back. The state Medicaid agency now faces a federal lawsuit from families of medically complex children. They say the Family and Social Services Administration violated the Americans with Disabilities Act. Melissa Keys is the executive director of Indiana Disability Rights, joins us now for our unfiltered conversation. Melissa, thank you for joining us. Because your lawsuit involves the ADA and federal Medicaid laws, in simple terms, what exactly do you think they did wrong here?
Well, I wish there was a simple answer. And what we're really trying to focus on is that the system of services that we currently have, as complex as they are not built to best serve the needs of children with really complex medical needs. And so we're hoping through this lawsuit that we can finally get to a place in a system that will work for these children.
The lawsuit claims a denial of medical care. How so?
Well, each case is different and unique. And what we're really looking at is the state's obligation to make sure that people who are receiving services in the community are able to receive those services in a way that keeps them safe, as a way to prevent them from being institutionalized. And what we're alleging in this lawsuit is that the way that our current system is set up does not really work well for the needs of children with medically complex issues.
Tell us a little bit about the families that you're representing. How exactly would they be affected if they lose their benefits on July 1?
And again, each case is different. And this is really the focus on this case is making sure that there's a system in place that will support the needs of these children, not necessarily making sure that FSSA does or doesn't do something. As you can imagine, Medicaid law is very complex, and trying to craft a solution can be very challenging. And so we're hoping with this lawsuit and not having to necessarily focus on each individual case by having an organization like the Indiana Protection and Advocacy Services Commission stand in the place of a lot of those families and constituents will allow us to have the time and space to really try to contemplate a system that will work.
Is the issue here more, Melissa, about the decision to end the program itself, or is this really more about how the Family and Social Services Administration went about it?
Well, certainly all of the attention due to the different budget issues raised a lot of awareness about this. But if you look at the system as a whole, how it is designed to work pre-COVID, during COVID, it's never really been contemplated as a way to address the needs of children with medically complex needs. Now, because of the various programs and the way that FSSA had allowed the program to be administered, families were able to cobble together a patchwork of systems and services and caregivers that, for lack of a better term, worked for their family. And now that there's this shift in policy, families are finding out that they're having to make some really devastating choices. And so what we're hoping with this lawsuit is that we can really work towards finding a solution that's going to work for these families.
I have about a minute left, Melissa. What are the next steps?
The next steps are hopefully we can have a conversation with those at FSSA and, keep moving forward to make sure that the folks that we serve at Indiana Disability Rights get the services that they need to live in the community.
Okay. Melissa Keys, thank you so much for joining us. We appreciate you taking some time.
Thank you for having me.